Welcome to the June 26th All-Member Poverty and Homelessness Board meeting. So we are going to go around and do introductions and give an opportunity for some people to log in.
Bonjour, Chair Murphy.
Yes. Hello. Pat, you want to do your introduction first since you started?
Hello, everyone.
Mayor Knudsen, we should talk sometime.
Good to see you, Commissioner. And Chair, so you know you are still, we can't yet hear you.
Oh, they can't hear us.
Nope, there you are. Thank you.
Okay. All right. Sorry about that, everyone. We'll do that, do a retake. Welcome, everyone, to the June 26th Poverty and Homelessness Board all-member meeting. And before we get started, we're going to go around and do introductions because I see people are hopping on and we want to make sure we have a quorum today. And we will, because we're going to talk about we have a full list here from the strategic plan, the continuum of care application debrief, point in time count, funding update, the strategic plan, the committee updates. And then we'll have time for public comment. I did that a little bit out of order. So, but I will go ahead and start. I am Sean Murphy, and I am the chair of the Poverty and Homelessness Board. Go ahead, Mike.
Mike Fleck, I'm a member of the board.
My name is Jack Boyson. I'm a member of the board.
Amanda Borda. I'm a Senior Program Services Coordinator with Lane County staff.
Hi, I'm James Yu. I'm the Homelessness and Community Action Manager with Lane County and staff.
I'm Matthias Smith, Vice Chair and Youth Representative.
Then I'm just going to go by the pictures. So, Mayor Knudsen.
Hi, everyone. Good afternoon. Mayor Karen Knudsen from the City of Eugene.
Mayor Van Gordon.
Good afternoon, everybody. Sean Van Gordon, Mayor of Springfield.
And Genevieve.
Hi, I'm Genevieve Schock. I'm a board member and rural serving elected official as the Upper Willamette Soil and Water Conservation District.
Thank you and welcome. Heather.
Heather Quasanza, Community Supported Shelters board member.
Thank you. Commissioner Farr.
Sorry, Commissioner Pat Farr, co-vice chair.
And Catherine.
Hi there, Catherine Ryan, she, her with Pacific Source non-voting member.
Okay. And did I call on everyone? Oh, Sherry, sorry.
Hi, I'm Sherry Walton. I am a voting board member.
All right, thank you. And please, if you are a member of the Poverty and Homelessness Board and I missed you, would you speak up? All right, I think I got everybody. Oh, I did miss. Who? Oh,
Johanna?
Go ahead.
Hi, I'm Jana. I'm a new board member. I work for Full Access here in Eugene.
All right, thank you. Sorry about that. All right. And with that, It's time for our public comment. Anything? Okay. All right, we're going to keep chugging along since we don't see anything, because we normally end up running over in some area. So we'll save that time. All right, and now it is time to approve the consent agenda, which includes the minutes from the April 17th all-member meeting, the May 2025 Statement of Revenue and Expenditures and Financial Dashboard, the updated league roster, and the all-in financial dashboard. Do I have a motion?
I'll move approval of the consent agenda.
Thank you. Do I have a second?
I'll second.
Thank you. Discussion? Okay. All those in favor?
Aye.
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 Any opposed? Any abstentions?
As a new member, I abstain.
Okay, thank you. All right. That was Genevieve.
She is
Right.
abstained. Okay.
Yeah, she abstained. Yep. And the motion passes. Thank you, everyone. All right, and I'm going to turn it over to James for the funding update.
Thank you, Chair. I wish I had more positive news to share, but we are at least getting closer to having, I think, the full picture of what our funding is going to look like, at least on the state level at this point. So next slide, please, Brianna. So this is what we know as of right now, and I will also say I haven't been checking the state news this morning, so this is actually what we know as of like yesterday at 5, so ever changing this time. But as has been previously shared, the Governor Kotek's proposed budget had been significantly reduced based on the state taking into account the federal funding cuts. It's looking like the budget that came back out of that is the one that's likely to make it through to approval. So currently, the OHCS budget, also known as House Bill 5011, has made it through the Oregon House and is currently sitting with the Oregon Senate. My understanding from conversations I've been a part of is that there's indication that it will likely be approved by the Senate either today or tomorrow. What we know are the numbers that are up there currently. So in the areas of emergency shelters, rehousing, for the purpose of Lane County, I just highlighted that that's where we use, that's how we fund our diversion program, so through the all-in funding in the rehousing category. Long-term rent assistance, or LTRA, and then prevention assistance. So as you can see, there are fairly significant reductions in all of those areas in regards to what is likely to get approved and what was originally requested by Governor Kotek. Where we see the most significant reductions, obviously, there are within rehousing, which is almost $140 million less, and then in prevention assistance, which is a little less than 130 reduction. One silver lining, or a couple silver linings to highlight, through the Christmas tree bill process, which I admittedly am fairly newly learning about, and so I'm not going to explain what that is. An additional $11 million was identified to go towards homeless prevention assistance. So that's a positive. There are still significant cuts in the areas of prevention. An additional silver lining, $10.5 million was set aside for permanent supportive housing and resident services, so that will support programs like MLK Commons and the NEL. You know, as this state budget moves through the process, we'll learn our local allocations. Historically, Lane County has received in the ballpark of 10% of the state allocation, so you can look at those numbers and accordingly see what we are likely to end up getting in allocations, but we won't know for sure until obviously the budget has been approved and then we get our agreements from the state. Next slide, please. Another silver lining is that as a part of that Christmas tree bill, $14.5 million was secured for the Behavioral Health Stabilization Center that I know many of you are familiar with. The Stabilization Center is a partnership between Lane County and Peace Health, and it'll be a new behavioral health facility that will share campus in Springfield near the Riverbend Hospital. So that is certainly a major success and a major win. There have been questions about the funding for the Stabilization Center since it was initially thought up. So I'm excited to see where that goes. Next slide, please. Recognize this slide is a little bit blurry, but it's a bit of a reminder or a lesson in civics of how the annual federal budget, the process that it goes through. I'm not going to read each of these sections, but the key pieces are the highlighted ones. So that's where the federal budget currently is, which similar to the state budget, it is currently sitting with the Senate and conference committee. We have heard that the president is hoping to have the budget sent to his desk to sign by the 4th of July. I don't think there's any indication that that's likely to happen. It could go with the federal fiscal year being starting October 1st. It could still be up to end of September until we hear anything on a federal level. Hopefully, it won't take that long because obviously that's a major portion of the funding that comes through our community and obviously is very relevant to our continuum of care. Next slide, please. So on the federal funding level, the primary unknowns that we are awaiting formal word on are LIHEAP, the Low Income Heat and Energy Assistance Program, SNAP, CSBG, the Community Service Block Grant, and then the Emergency Food and Shelter Program. That's roughly over $10 million just within those programs that flows through Lane County. What we do know that is secure for the upcoming fiscal year is ESG funding, Emergency Solutions Grant funding, which I'm going to go back to, and then Community Development Block Grant funding, HOME, which I learned is also not an acronym, it's just HOME. And then our Continuum of Care and Youth Homelessness Demonstration Program grant funding is secure through the next fiscal year. As a part of the federal budget, there is a proposal to integrate COC funding into ESG funding. So that would lead to funding reductions overall, significant overall funding reductions, and a change in program model. And so that obviously is a big unknown at this point in time is how continuums of care will look if that change happens, if those funds are filtered through ESG. So as we go through the federal budget process, we hopefully will learn more about how that could affect our COC. Is there one more slide? No. Any questions about federal funding? And if anyone has any updated information that I left out or got wrong, please feel free to chime in.
No? See? Okay. Thank you, James,
Me
for
next
the
as well.
update.
Yeah. Yes, you're welcome. Yeah, we'll continue to keep you all posted as new information presents itself. All right, switching gears to the point in time count. Next slide, please. So the results of the point in time count were released last month. I'm sure many, if not all of you, have seen those results. I'm going to touch a little bit on some of the trends that we saw this year, and then also some reasons that we think there may that may have led to the increases in homelessness that we saw. So as a brief reminder for folks, HUD and OHCS require that continuums of care conduct an annual count of folks experiencing homelessness on a single night in each January. This year's PIT count occurred in Lane County on the night of January 29th. Because of the YHDP funding that we have, we did also have a special focus on counting youth experiencing homelessness this year. In addition to the standard ways we've been surveying folks through the PIT. There was also a youth event held at the Youth Era drop-in center downtown. And so they had food and I think a raffle and just some strategies to try to bring youth into that event. As has been the case now for several years, we supplemented our HMIS data with in-person surveying by our street outreach team. So we continue to have full geographic coverage of street outreach across Lane County, and we're able to utilize those outreach teams to help with surveying again this year. And that's really, the piece of us using HMIS so robustly for the pit count is unique across the country. And we again received special permission from HUD to be able to utilize our by name list data for our pit count. And our HMIS team was recognized and were presenters at a national HUD event this year to share the model that's used. So just a testament to our community's HMIS data and how robust it is and how accurate of a reflection it is of folks experiencing homelessness in our community. Next slide, please. So as I'm sure is not a surprise to this group, we do continue to see the number of people who are unhoused in Lane County grow. One, I think, key point of this year's count is that January 29th was a night that severe weather shelters were open. So Egan Warming Centers, Catholic Community Services Hoteling, I believe the Cottage Grove warming was open January 29th. And so we saw nearly 500 additional shelter beds that were operating that night, which likely results in a much more accurate count because, there are folks that are not going to access shelters, whether because they're not available on a given night or they're not interested. But when there's a severe weather event and there's beds available, and obviously being outside is incredibly dangerous, we see folks that may not normally access services showing up at the warming centers. Continue to see, I'm going to touch on this on a following slide, but continue to see that housing scarcity is a primary driver of increases in homelessness across the country and in our community. Additionally, as we have moved out of the pandemic, at the height of the pandemic, everyone was being told to shelter in place, and that included folks experiencing homelessness in encampment. So when we were doing pit counts during the height of the pandemic, it was easier to locate unsheltered individuals because they were largely remaining in the encampments that they were in. As we've moved out of the pandemic, unsheltered individuals are being scattered more regularly, which makes it harder for street outreach teams to be able to find them and engage with them. A couple notable highlights of this year's count. We saw that 52% more people were sheltered, largely due to those severe weather beds being open, and slightly fewer folks were unsheltered than the 2024 count. Additionally, the percentage of individuals who are chronically homeless and sheltered has increased from 2020 to 2024 from 25% to 46%. Next slide, please. This bar graph shows the direction that things have been heading with point counts over the last 5 years. So obviously you see a steady increase in both unsheltered and sheltered homelessness. And then again, that noticeable increase this year in the amount of folks that were sheltered. Next slide, please. So this graphic is used just to kind of highlight our homeless services system. So this is a snapshot of January of 2025. And I know we're talking about human beings here, so the terms inflow and outflow aren't meant to devalue the fact that these are human beings. We're talking about it that are experiencing homelessness. But this sync graphic shows that in January of 2025, we had just over 1,000 new individuals entering into the system. 3,333 were currently in the system, and then in that month, we exited 748. So clearly, more folks are entering into our homeless services system than are exiting out of the system. So we need to look for strategies that can be used both to decrease that inflow, so things like homelessness prevention, diversion, and then ways that we can turn the faucet and increase the outflow of folks that are exiting into permanent housing. Next slide, please. So when you look at the best way to exit folks into permanent housing, that's obviously working to find housing in the community to get them into. And as I previously noted, we continue to see that available housing in our community is, or the lack of, is the primary driver of the increases in homelessness. So when you look at healthy vacancy rates, which healthy vacancy rate is defined as basically you have demand meets supply. And so that's been deemed that 5 to 7% vacancy rates are considered healthy for a community. When you look at the national average, it's been within that healthy vacancy rate or slightly above at times over the last 5 years. When you look at the Eugene-Springfield metro area, this is specific to Eugene-Springfield, not all of Lane County, you see that we have not ever hit a healthy vacancy rate in the last 5 years and have been quite far from doing so several of those years. And this comes from the Multifamily Northwest, which is a property management and landlord organization, and they release this data, I believe, quarterly. Next slide, please. And this is just comparing the Eugene-Springfield metro area with other communities in Oregon. These clumps of communities were put together by Multifamily Northwest. I picked these ones rather than Portland metro area just because of the similarity to our community, whether it be geographically or population. So you'll see that in addition to nationally, Eugene-Springfield across other Oregon communities continues to have reduced vacancy rates in comparison with other cities that are similar. It's especially noticeable when you look at 3-bedroom units. So when you think about families in our community that are experiencing housing instability, that have children, incredibly difficult for those households that have multiple children, multiple members, to be able to find 3-bedroom units that they're going to be able to move into. So in summation, obviously there are multiple factors that lead to increases in homelessness, but really just continue to see that the importance of our community needing to work on increasing the outflow by helping to create more housing opportunities in our community. Any questions about the PIT count? Well, thank you.
Amanda, you ready?
Put up my slides. There we go. Next one. So again, Amanda Borda, Senior Program Services Coordinator with Lane County, COC lead. I'm just going to cover, we received our Continuum of Care score for our fiscal year 24-25 application. So I'll just cover kind of where we scored on that and some things that we can improve on in future applications. Just to recap our summary of that award, which I've already covered in previous meetings, we received about $7.2 million in that award for renewal permanent supportive housing and rapid rehousing, as well as our youth homelessness demonstration program grants, homeless management information system grants, and COC planning, as well as coordinated entry for domestic violence. And in this application, we submitted for expansion of HMIS and Connections Rapid Rehousing through reallocated dollars, which were also awarded. And these awards also included the FMR fair market rent increases that are standard, as well as the first-time cost of living increase for supportive services, which had not been previously provided. So that number includes that increase for those projects that have that line item as well. Next slide. So just to cover the sort of trend or trajectory of our COC funding, you can see from the last 10 years, our COC funding remains fairly consistent from year to year because the typical increases are just for new projects or for, which are limited based on it's a percentage of our current amount that we receive. So it's always fairly limited what we can apply for, as well as there are typically just those FMR increases. So this is the first time we've had the cost of living adjustment added. So these grants stay fairly consistent over a long period of time, even though the cost of operating those programs increases as well. You can see the biggest jump that we've had is really just adding those YHDP projects in the last couple of years. So that has significantly increased our resources under the continuum of care, as well as adding a few new projects over the years. Next slide. So we receive a score each year after our application is received and scored, and several months after we get this scorecard. It's always sort of limited in terms of what we're able to see. It provides a general description of the scoring that we received, but it does not provide a question-by-question score. So there's always some mystery to it as to certain areas that we can improve. It's kind of very general. Which isn't helpful, but this one is a little bit more detailed than it has been in the past, so I'll give HUD credit on that. It does provide a little more insight on specific questions. Typically, it's more like per section scoring versus all the questions. And so you can see that we scored 154.75 out of 200. We're right about a little bit above the median score, so we're scoring fairly well, certainly not below average. There are a couple areas here that I've highlighted that are the primary drivers of our score being lower, and that is, one is system performance and the other is coordination of housing and healthcare. On the coordination of housing and healthcare, we have received some of those points in the past. This isn't general commitments of housing resources or healthcare resources for our COC. It's specific to those housing resources and healthcare services supports being connected to a new project that you're submitting. So it's much more limited. I think we do have healthcare commitments, and we do have a significant commitment of vouchers and housing choice vouchers in our COC, but this was specific to the new projects. We did submit an expansion of the BOB program for this year, but it was not awarded. So I'm not sure if we just don't receive these points if it's not awarded, or if it didn't meet the metric. It was the same commitments that had been provided for the initial BOB award, which we did get those points. So I did submit a question to HUD on that just to clarify, but did not receive a response on that yet. So those 14 points we did not receive. And the other area you'll see is the system performance section. Next slide, I'll cover that in a little more detail just so we understand where we lost points there. This is tiny, but it just provides a comparison from year to year of our scores, and you can see some of that. The sections kind of change slightly, so and the way that they report the scores change each year, so it's not a direct comparison by line, but you can see some of them are fairly consistent in terms of where we scored on system performance, and our other areas we are scoring pretty consistently from year to year. Next slide. So just to cover a little more detail on the system performance measures, since that's the area where we could really see the most opportunity to gain points in future applications. I did kind of cross-reference this with the scoring criteria that was in the notice of funding. So for reduction in number of first-time homeless, this one, again, as I covered in the system performance metrics, portion that I did a couple meetings ago. This one's a little misleading in that it is really related to those who are entering into a shelter or transitional housing for the first time, not necessarily those who are entering into our system for the first time, so a little bit different definition and is a little misleading in the number. But regardless, we must demonstrate a reduction in that number, and so for this one you can see we did not get that point, so the numbers clearly had gone up. And this is always looking at the previous year, so this would be 23 to 24. Just for reference. Next one is a reduction in the number of individuals and families. So this is not in our scorecard because I think they just assume you can probably figure that out. It's based on our point in time count. So not necessarily the one that James just covered, but it would cover comparison from 23 to 24. So we would have to get those points, which I don't think we received any of these points. You would have to see a 5% decrease in your sheltered numbers and your unsheltered numbers, as well as in your overall count. So you can see that some of our numbers do fluctuate and at times have increased. And so, and if they do decrease, I don't think that we've seen the level of 5% or more. And so I think this is an area where clearly we're probably not getting those points consistently. Next slide. Either way, questions at the end or?
You are the presenter, so I leave it to you.
I'm happy to answer a question if there's one specific.
Commissioner Farr?
Thank you, Chair, and thanks, Amanda. This is kind of a general question, but I'm going to specifically point out one particular line on the scorecard. When we're presenting scores to to get our COC score. That feels sometimes almost like gaming the system. You have to present the numbers as they want to see them. It's not necessarily reflective of how well we're doing serving the people who are needing services in Lane County in a metropolitan area. And I'm going to point specifically to coordination with housing and healthcare, where we get 0 on the scorecard. And I'm reading that correct, Amanda, correct? We're getting 0 on that out of a maximum score of 14. Mm-hmm. And as we know that we are actually providing healthcare, but we're not doing it in a way that they recognize the numbers as being reported as providing healthcare in coordination with housing. Mm-hmm. So that's just a general statement on it. But for instance, the River Road Navigation Center, which doesn't really count as housing, is that correct, Amanda?
That one I believe counts as shelter.
Yeah.
But you're right on your housing and healthcare point, and I think to the shelter point, we have changed some of our alternative shelters over the last few years to be counted as emergency shelters. So things like that might impact those numbers, whereas it looks like we're now having an increase of folks coming into our system for the first time. Those folks might have been there for a while, but had been in a program that didn't count towards that measure. Like you said, it is really specific to how HUD looks at these measures, not necessarily like, right, as I mentioned during that system performance measure presentation, there are different ways that we look at things locally to determine success. This is really just how we're measured on being a successful COC in HUD's perspective.
And my point on this, Amanda, and Mayor Knudsen, I'll look at you because you and I kind of touched on this in a conversation we had earlier, is the general public, if they were to look at this scorecard, whether it be a reporter or a layperson, just simply look to the score, how are we doing? They say, well, you're not even coming close. You're doing 0 on coordinating healthcare with housing. And it's not the truth. So we have to make certain that we as a Poverty and Homelessness Board are able to communicate that the data surrounding what we actually are doing, particularly as we move forward with the strategic plan, that we have metrics in place so that people, if a reporter were looking at this scorecard, they'd say, well, we're 0. And we're not 0. We know that's not the case. So how do we get that information to the people who need to understand that not only are we moving the needle, but they can help because the needle is moving. People tend to despair and say, I'm not going to do anything because you're not doing anything. But if we can report the numbers in a way that demonstrates, and we know this through numbers with Food for Lane County, for instance, if you can demonstrate that you're doing a good job, that you're using your resources well, people will grant you or not begrudge you more resources. So that's a general conversation. It's something that I think we need to talk about, particularly as we look into the elements of the strategic plan. How do we make the strategic plan report the numbers to people so they can have some confidence in the work that we're doing? So, and that wasn't directly related to the scoring of COC, but it was generally scoring in general. How do people perceive how we're doing? And pardon me for running on that, but it's a pretty important issue to me.
No problem. Thanks, Commissioner Farr. Go ahead, another question.
Yeah, my name is Sherry. I work at the River Avenue Navigation Center. So I just think it's really interesting. I would love to drill down a little bit more on what do they mean coordination with housing and healthcare? Because at the shelter, I can tell you that every Tuesday we have a mobile van from the county out here. I know that we just opened another medical respite center. So what do they mean by that? And how do we increase that score? Because I feel like we're going in the right direction. And he's right. I think when I look at it and I'm brand new on the board, I'm like, why did I get a 0 when we're doing all of these things?
Yeah, so just to explain a little further on that one, so we don't have a narrative response on that question. It is specifically if you are submitting a new project for bonus funding and that new project has committed units that are outside of COC or HUD funding. So primarily like project-based vouchers or other local housing resources that you have of committing units in your community that are not paid for by HUD and COC. And so you'd have to attach that commitment to your application. The healthcare resources is specifically healthcare sources for supportive services funding. And I believe that does not actually include Medicaid billing. It's more specific to like healthcare commitments to provide supportive services in the project again, that you're submitting for a new project. So it isn't general to the COC. There's no narrative related to this. It is just what you attach and whether it meets their requirements. So it's very narrow, and I agree it's not a sort of good metric to determine whether we're coordinating with housing and healthcare, because we have significant resources committed in our voucher system locally for a number of projects, the NEL, MLK Commons, the Bob. So we have done a lot of that work to sort of integrate resources that we have, as well as healthcare resource commitments to a lot of those projects as well. And so this project, again, that we submitted that had those commitments, it did have them attached, the same ones that were submitted in the first initial application, where we did receive, you'll see in the previous years, we did receive 12 out of those 14 points. So same exact commitments, and this year we did not receive points. So we did not, in this, however, application get awarded that project. And so I'm not sure if you'll only get them if the project they're attached to gets awarded. I was unclear about that. So that's the question I submitted to HUD. But again, if you're just looking at the numbers, you're not going to understand that unless you understand how that's submitted in the application. So I hear that.
Pardon my butting in, Chair, but just to reinforce that, if I may, the fact that we're providing primary care to close to 30,000 people in our health centers in Lane County, that isn't reported any place in the numbers that HUD reports. So if people simply look at the COC scorecard, they don't get a picture at all as to how well we're doing in the cities and in the county regarding providing healthcare and other elements that are scored. And Amanda, it's not a criticism of the way we report. It's more of a criticism of what they want us to report.
Yeah, and we do try throughout our narrative to sort of plug those things in wherever it might make sense so that we can communicate that work that's being done. So even if a question's not specifically asked about those things, we do try to put in those pieces wherever it might make sense to communicate.
Just want to make sure, Genevieve, did you have a question? I thought I saw your hand up.
I did, but it was somewhat answered because I was curious if the health-related social needs and Medicaid billing for housing fit into this somehow, and it sounds like that's not what they were looking to track, because I just know there's some overlap in the emergency shelter providers and HRSN providers. So I think I understand the answers now.
Go back to slide 7. So the next ones are reduction in length of time homeless. This is for 13 points. So this is essentially reducing the length of time people experience homelessness. This one we did score decently on in terms of our data. We clearly had a reduction between those years. That would be 23 to 24. I'll tell you from 24 to 25, we did have an increase, and so we would not this year meet that metric. But clearly we have more to do in our written response in terms of our strategies to reduce that length of time. So that's an area we can work on. And then in terms of exits to permanent housing and retention in permanent housing, that one is one that we have talked about that we've struggled with. Our exits to permanent housing across our system are low. And so you would need to meet the threshold of increasing that rate by at least 2 percentage points or have a rate of exit of 50% or higher. Our rate for that year is 16%. Which was a 3% decrease over the previous year, actually. So not going in the correct direction and certainly well below that threshold. So that's something we've talked a lot internally about, strategies to kind of reduce and focus on those who have the longest lengths of time homeless and end up and really focus our shelters and all of our resources and having that housing focus so that their intention is always to exit folks to housing as much as we can. And we know part of that is just the lack of sort of housing pathways that we have is going to remain a challenge. So that's another area we need to strategize around. Next slide. Let's see. So returns to homelessness is the extent to which people return. We scored full points on that metric, so we do have a low rate of return. And then the next two are related to both employment and non-employment income, so income from benefits as well as employment. Those we did not score on the data side, but did receive the points for our narrative strategy response. So for those, you would need to see an increase in the rate of which people have employment income or non-employment cash income, or that your overall rate for those is 20% or 50% for non-cash, which ours are not, I don't believe, meeting that metric currently. I don't have the number, but could always pull that if folks are interested. Next slide. So just takeaways, we're scoring well on some areas consistently, just in terms of our broader COC, coordination engagement, as well as how we do our local competition with our evaluation and ranking. We get points for how that process looks, and so we've received good points there, as well as our HMIS and PIT questions. And so those areas that we need to improve on our system performance, and then in subsequent applications, if we are able to provide a new project application, again, really making sure those attachments and those commitments are there for that project that meet that coordination with housing and healthcare. But again, that's limited in what we're able to do there. So I think system performance is really the area we could make up points if we wanted to. Next slide. We also receive a coordinated entry bonus score debrief. We did submit a project for expansion of the current domestic violence coordinated entry, SSO, or supportive services only project. So we were not awarded the expansion. Our project did not meet the threshold for funding, so we received about 80 points. And they noted that the project would need to meet at least 86.8, which was the score for the lowest project funded. So that one was not awarded. Areas where we can improve, again, we receive new projects partly based on our overall COC score. So there's a portion of the score you see at the top that is in direct correlation to the score we receive on our application. And so that's sort of a ratio that's applied. So the better that we do on our COC application score overall, the better chances we have of being awarded new projects. And so the other area is really just the need for the project, where we submit for that section kind of various data to show the need for this project, as well as just overall domestic violence in our community. This has just been a challenge that we've had in terms of the data we have available around domestic violence. We have very limited providers doing that work that are able to provide the data that we have. And it's difficult to get that picture in terms of who's fleeing domestic violence. We hope that the current coordinated entry grant we have will create that very clear access point and get us to better understanding who's trying to access services, who's fleeing domestic violence, and so that we might, as we move through that project, get a better understanding of that population. But so far, that data has been fairly limited in what we're able to articulate in our application. Next slide. So what's next? Just a couple caveats. I did explain our award initially included our coordinated entry DV grant, the one that we already have. We are currently submitting or have submitted an appeal. So that one was included in our award initially, and since then we've realized there was HUD realized there was an error, and they had assumed our grant went for 2 years, but it actually went for 1, and so they denied that renewal. And so we are appealing that decision in hopes that that will be resolved. So fingers crossed, we'll update you on that. We also received our grant inventory worksheet. So that's the sort of first step in the next competition. Again, we won't have a full notice of funding as of now. We don't know if we'll have anything this year, but we do complete our grant inventory worksheet, and that's what's happening currently. HUD has indicated there could be an updated notice this year, so we don't know what that will look like. We can make project changes in this upcoming competition period if we want. We did just complete the intent to renew and sort of project reviewer evaluation process. Those initial summary reports just went out to agencies this morning. So our local competition is kind of completed, and we're just kind of awaiting to see what we'll need to do. But we don't anticipate, submitting major changes to the projects this year, just given the many uncertainties with funding. I don't think it's a time to be doing major changes to what we're currently funding. There's nothing that we're currently looking to sort of make a huge shift on in terms of our projects. And then other than that, we'll just continue, like with the strategic planning process, continue to brainstorm around ways to include that system performance measures and make sure our strategies are really having impact on the numbers that we want to see. That was it. Any other questions?
Okay. Thank you, Amanda.
I would just note one thing that Amanda's presentation didn't include is the amount of time and effort she puts into that application, and so just want to acknowledge the immense amount of work that went into that process.
Thank you, Amanda. Okay. Oh, go ahead, Mayor.
Thank you so much. And thank you also, James, for saying the first thing I wanted to offer, which is just my appreciation to the staff. I think one of the things that's clear from even your explanation around some of the finer grain details of the scoring is that the complexity of just the application is significant and very much appreciated. I just echo Commissioner Farr's comments that so technical and also presented maybe in a way that doesn't quite help the public understand at the top line and with some of those headlines. It adds another layer of challenge in that you are being scored for one thing that looks like you're being scored for something else. And there's a lot of really good work that's been happening, both within the county, certainly, but also with other partners when I think about the coordination of resources and services to our unhoused neighbors and as it relates to healthcare access and supports. So lots of positive thoughts there. My question, and sorry for that long preamble, is just how or if, as you're looking at this feedback, this scoring of our county efforts, who are our peers? Like, who are our jurisdictional peers, and also who are our sort of aspirational jurisdictional peers as it relates to this work? Is it guiding in our efforts? Are there other places that we could be looking to understand how they're making more progress on in these different areas, or how they're making progress? Just curious if you could speak a little bit to that. And then I just have one more comment at the very end that I want to be sure to say because it's important to note.
Yeah, sure. So there are, certainly about 400 COCs across the country. It's really difficult to compare on a sort of apples to apples basis because every community has different resources, different structures to their COC. Some are operated by nonprofits, some are local government, and so it can really, they can be an entire state or just a single city. So it's very difficult to sort of compare necessarily of whether we're doing well compared to other similar COCs, but we do a lot of collaboration. I participate in, nationwide COC calls where we're sharing best practices, really participate in a lot of the National Alliance to End Homelessness resources to hear what other communities are doing and sort of gain insight to where folks are seeing progress. HUD likes to highlight those communities as well, typically, that are seeing progress in certain areas. They just had a call today with the COC of Dallas, where they've had a lot of success with engaging folks in street outreach and addressing encampments. So we're always looking to find those insights of where folks have had success and what we can replicate here in our community, but I don't know that I know of a specific COC that we would necessarily have a direct comparison to.
That is helpful also, just to understand in terms of how this scoring feeds into what you all are looking at day in and day out for reference points. The two quick thoughts I wanted to offer. One is that there is really remarkable coordination that happens year-round, but certainly in January related to the point-in-time count. It strikes me that, especially with reports like this that could be easily misunderstood or have maybe not the most helpful conclusions drawn from top-line headlines, that a coordination communications effort, once we have this information back across jurisdictions and with different PIOs, that piece of this work, I'm sure, is underway, but it's also something that I'm sure that your elected officials would be happy to support in terms of community conversations and outreach, because we talk a lot about the process and the inputs and the framing of the problem in different ways, but I think closing that loop with the community and helping people to see where we're making real progress and also where the progress we're making might not be captured in the reporting process, that's valuable work for us to do as a community as we're trying to organize ourselves effectively. And then the last, so I just leave that there as an offer and as a general comment and something I'm happy also to support and help in the ways that I'm able as the mayor of the city of Eugene. The last observation I just want to make is that even though it wasn't something that was stated, there is a trajectory of improvement in this process that is incremental, but is absolutely a trajectory of improvement. And I haven't noticed, a significant increase in the resources coming to this work during that same time frame. So seeing the improvement during that same period of time, I think, is also important as context for people to be aware of. So thank you for all of this good work.
Thank you.
we have other, do we have others? All right. Thank you, everyone, for that conversation. And I think as we move towards the strategic plan and look at some of the components of that, some of the things that we talked about in regards to information and consolidation, how we're talking not only about what the COC does, but what is happening within the community and how that's communicated. Feels like it's going to be addressed in the strategic plan. So thank you, Commissioner and Mayor, for that introduction, probably to what everybody has been waiting for, which is the strategic plan discussion.
Yeah, so excited to reach a culmination of the many months of work on getting to the new strategic plan. I'm not going to talk much. We're going to open it up to board members to provide input, but I did just want to cover what has brought us to today, just the timeline as a refresher for folks and the steps that have been taken through this process. So as I'm sure you will remember, started really with a homeless system design clinic at the Lane Event Center, had the National Alliance to End Homelessness come and help with that event and really provide some really important input and data as we began the process. Extensive community engagement, one-on-one groups, surveying, as it notes on the slide, over 3,000 pieces of unique data. Brittany Manzo, the consultant that we used for this process, really went above and beyond in connecting with community folks to get input and looking at data and, comparing our community with other communities and just vast research in that area. After creation of a first draft, that was brought to task groups, PHB committees, a variety of local groups, League, our lived experience group, just to further get eyes on the draft and really, get it moving in a direction that everyone felt comfortable with. Again, we had further input through surveying and feedback on that draft and also on the prioritizations and the strategies that we were looking to use, especially in that first year. So that happened via surveying with the QR code access survey, and then we also had an event again at the fairgrounds where we were able to engage folks that showed up for that in conversations about what they were hoping to see in the strategic plan. As we moved into April, we completed the second draft. And then as we continued through the spring, continued to get feedback both from this board as well as community members on that plan and the priorities that should live within that plan. And that really has brought us here today to having a final draft that fully encompasses all of the feedback and input that this board has provided. And we look today, hopefully, to get that strategic plan approved and move forward with continuing to do the work. Just the final pieces will be, developing the work plan, the work of the ad hoc committees, and then we'll need to get commissioner approval in September, October to have it fully implemented. And with that, I'll turn it back over to the chairs. I think Chair Farr, I know, wanted to give, some perspective on strategic planning, but really open it up to you all for discussion.
And so.
I beg your pardon. Go ahead.
Oh, no, I was going to say, I know normally we would do Robert's rule with throwing it out for a vote, but my first thought with this is, should we have a discussion first before we put it out there for a vote to approve? Because with Robert's rules, normally I would ask a motion to accept the document. And so I'm checking to see, does anybody have go ahead.
I would be comfortable with brief discussion or comments from members of the board before moving to that decision. If members have information that they'd like to share or comments they'd like to share.
Yes. Okay. We will start with the discussion. Thank you, Mayor. And I'll start with you, Mike, because you had your hand up first, and then we'll just keep going.
Thank you so much. I really apologize. I've been through this a few times and I did not catch. I'm looking at in this draft, pages 11 and 12, which talk about systemic goals. And I'm not seeing anything around prevention here, and giving the challenges currently in funding prevention services and the potential loss of even greater funds towards this. I wish there had been, like I said, I'm happy to adopt as it is. I just, if we go through this process again, would love to see, some prioritization about, sustaining prevention funding.
Thank you. Any comments up for discussion from others?
I found a couple typos. I'm not sure if anyone cares.
Yes, yes, we do care.
Okay. Yeah, so here I have, I believe on page 11, it says reconnect and grown network instead of grow. And that's also in title case and the rest is in sentence case, but that's probably a bit in the weeds. On page 17, priorities for action planning, strategy 1, section 2, increase safe living spaces for people, it says while experiencing homelessness, instead of just experiencing homelessness, I think on page 18, strategy 5, number 3, the phrasing of create forums and processes that hold public systems accountable to doing harm towards people, for doing harm, potentially. And then under number 5, the very end of it, goal of establishing one-day center in regions of the county. I wasn't sure if that was in several regions or, that's it.
Yeah, thank you. That's definitely helpful.
Commissioner Farr?
Thank you, Chair Murphy, and I'm happy to go very last in the queue if other people wish to speak.
You said Heather?
I was just curious. Oh, well, Kate answered my question, so never mind. Thank you, Kate.
Now I think you're ready, Commissioner Farr.
Thank you. Then I just wanted to talk a little bit about where the Poverty and Homelessness Board has been with strategic planning from its outset. We've had a strategic plan, and the initial strategic plan we had was very robust, broad-reaching, and tended to knit tactics into strategies. And I think that making certain that we identify the strategies that each, not just us working together, but each jurisdiction is able to bring to the table. The PHB doesn't tell the city of Eugene what to do by any stretch of the imagination, nor the city of Cottage Grove or Florence what to do, but hopefully helps to coordinate the efforts in the jurisdictions inside of the county so that we can leverage the work that we do to bring in even more resources. Now, resources are probably in the most dire straits in the being at the current time. But that being said, as Mayor Knudsen said just a moment ago, without new resources coming in, the trajectory has been a positive trajectory, and we can do more. And I think that the fact that beginning, and I'm not going to use COVID as an excuse, but it was certainly a vehicle that caused us to meet less frequently and perhaps be less coordinated in our efforts. This is a chance for us to get back together with this strategic plan, which we've all worked on. And while no plan is perfect, it helps us to develop tactics that are measurable, that we can report to the community as to what it is that we are doing. Specifically, that people can understand, that they can understand the way that we're talking in terms that they understand. Let me put it that way, that people understand what it is that we're doing and how the needle is being moved so that they can once again be a part of the process. I think it is important that we're able to develop metrics that show the progress in terms that people understand. I'm looking forward to this plan. I'm looking forward to us working on it And in response to Mike, the prevention, while it's not a part of the actual plan potentially, it is certainly a part of the strategies that we use to implement the plan and to increase the service that we provide. I kind of stumbled around with my words a little bit right there, but the bottom line of this is I'm really excited that this is a chance for us all to coordinate our efforts and to really demonstrate to the public that while there are still people camping on the corners every day of the week, we are making progress and we are addressing the needs of the people in our community that rely on the cities and the county for services that they're unable to provide themselves.
Mayor Knudsen?
Thank you, and I apologize. I thought I had raised my hand a little bit earlier, and I did not successfully click that button. Just a couple of quick thoughts. One is that I appreciated the heads up and also the note added for context at the beginning of this plan about how it was developed, the time in which it was developed, and of course, the expectation going forward that we will be working to take this input and all of this information and the outlines and initial matrix of systemic goals and then work to prioritize and align those goals with areas and resources, acknowledging that we're headed into a time of really significant resource uncertainty, as we're seeing with even just that snapshot of the state's budgeting process. Related to that, I'm really looking forward to that prioritization work and the ways in which this strategic plan can help us as individual jurisdictions to then go and look at our own capacities, our own efforts to coordinate internal to our jurisdictional efforts, and then also feed that back into the process around prioritization and work groups in the fall and into next winter so that we're just continuing to extract the value of this coordinated effort and can see the ways in which each jurisdiction and each community is going to be focused and how the resources available are going to be focused. I do think that, at the highest level, it's so valuable to have this plan across our jurisdictions and among so many partners that will help us to map success, and that also it's incredibly important that shared success be supported by every jurisdiction's engagement and every jurisdiction's participation in this work. So I think we're looking into a future where that reflection of shared investment and shared attention can generate shared progress. And that's truly the highest, I think, level value of this kind of coordinated and strategic effort is delivering on that promise of project for our community broadly. So thank you for the efforts going into this, and I'm really looking forward to the continued work and how we can use this independently and then also back together as we head into the fall.
Thank you. Do we have other comments or discussions? No? Okay. So before go ahead.
Madam Chair, I'll move approval of the final draft of the strategic plan.
Thank you. So we have.
And I'll second. That's Heather.
Heather, okay. So we have Mike who motioned, and then I think I heard Heather, and then second. All right.
Yep, that was me.
Okay, thank you. Any other discussions? Nope, okay. All in favor?
Aye.
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 Any opposed? Any abstentions? Yay! Congratulations, Lane County. It has passed. I am very excited. I want to thank everyone and appreciate all the hard work that went into this. I really feel like this one was a community effort. It included a lot of voices, And I'm really excited to see this move forward. I think it will address some of those issues that, like we said, we talked about before, about we have the COC data that a lot of times is represented, but that is not a reflection of what is happening in the entire community. And it feels like this strategic plan really is trying to embrace not only what the COC does, but also what's happening in the rest of the community and how we can work together. So I'm very excited. Okay. And with that, do we have any questions in regards to the committee updates? Nope. Did all the committees? I think they did have an update back there.
We submitted updates with the packets. There were a couple committees that did not meet this last month, really just awaiting the approval of this plan to kind of determine what the next steps would be.
Okay. All right. So looks like those 3 committees that were waiting on us in the strategic plan. Please note, you guys now have to schedule your meetings. All right, and that moves us down to the draft agenda for the August meeting.
Yeah, so we'll move now to look to our prioritizations of our strategies for the upcoming year, and with that the ad hoc committee creation and creating work plans for the committees. Additionally, Carly Walker is going to be back from maternity leave, which is exciting, and she's going to talk about an HMIS fee policy that's going to be coming out. But really, the August meeting will be just a continuation of moving forward our strategies as a part of the plan.
Any questions or comments for James about the upcoming agenda? No? Okay, you guys made this meeting so easy for me. Like my stomach hasn't even had time to growl because I'm hungry. So we're just going to do the wrap up. So the next meeting in July is the executive committee meeting, which is going to be hybrid. And remember, we are at the Lawrence location for in person. Yep. So don't come to this building because no one will be here. And then in August will be the all-member meeting and we will be back here. And just as a wrap up, we approved the strategic plan. We got some funding updates. Boo. But on the positive side, I think what we have seen through some of the data and some of the other things that we talked about is that we are continuing to make strides and make progress. We're on the 1 step forward, 2 steps back, I think, and that's with all the unknowns that have continued to come our way over probably the last decade, I'm gonna say, with trying to address issues, and we are going to continue to move forward. And with that, I think we're gonna adjourn the meeting and give everybody 30 minutes to go out and enjoy that lovely summer day that we're having. And please be aware, the 90-degree, we're supposed to have some hot weather. The Lane County website has some information on cooling centers and what's gonna be available. So make sure if you can pass that information along. They also have a PDF that we can print out for folks and just have available if they don't have access to a computer. All right, and with that, have a wonderful afternoon, everyone. See you next month.
Thank you all.